Like me, you're working on the holidays. What is the state of play in the hospitals from your point of view?
Well, I mean, I think that between most of the waves, I think that the hospitals, by and large, certainly here in Vancouver or British Columbia specifically, COVID cases kind of rolled out of the hospitals, and we'd have some COVID-free time. Since the last wave, which was August, September, early October, we've always had COVID in the hospital, and it was about a week ago that we noticed, more people coming into the emergency room. There's starting to be an uptick in the admissions, and we knew that Omicron was going to spread across the country, and we were kind of just waiting for the uptick in the wave to present itself. And I guess it was just, here we go again, was kind of the impression that we had. There was an email that went out about 2-3 weeks ago from one of our division members, and it was like, well, I guess this is our Christmas present. This is the second Christmas in a row where, all of us are either working or we've had to cancel Christmas plans because of COVID, and it's a bit distressing for a lot of us, to be quite honest.
Can I get you to unpack that a little in terms of you go into that profession to help people and save lives, but as you're describing it there, the patience and the passion is being blunted by the fact that here we go again. What is it like working with your colleagues? What kind of conversations are you having at this time?
I think the conversations are fairly similar. I think we have two families. We have a work family and we have a home family. And, when you work those 12-hour shifts, or for us, the ICU docs, we work 7 days, about 24/7. And you end up using your colleagues and your friends at work as truly as a family of support and a network of communication and understanding. And a lot of those people are no longer there. They've burned out. We've lost people because some of our work colleagues chose not to get vaccinated, and not in the physician group, but in some of the other groups. And so, kind of one by one, we're losing some of those people that we were dependent upon for our own personal support. And then as our numbers get smaller, and in terms of the healthcare professionals, it's that much more work, and there are safety concerns sometimes about why are we going to be able to care for all these patients that are going to present to us in this wave. In the third and fourth wave, people realized that even though our politicians were saying that we had enough healthcare resources, they were really talking just about bed numbers. And, just because we can surge and take over, different surgical beds or different other critical care areas with COVID patients, doesn't mean we have the staff to care for those patients some days. And even now, it is Christmas. The mindset just a week ago for most people was that they're going to finally get a break. But yet now we're, ramping back up. Surgeries from an elective perspective are canceled by by Bonnie Henry here a couple of days ago. So now everybody realizes that, once again, we may be redeployed, in terms of the nurses and the respiratory therapists and some of the other care providers, to make sure that, as you asked, I went into this profession to care for people, and I will. But me and all the people that I have to, pull through this process are getting, tired of it, and not tired of caring for patients, but it's just the burden of this whole process and the burden of the virus, and wondering if it's ever truly going to wander away for us.
Well, to that point, look ahead, say 2-3 weeks from now, and what would you imagine it'll be like, and what would you like Canadians to keep in mind as they gather over the Christmas holidays?
Well, I'm in the ICU over the weekend, and then I have 7 days off, and I'll be back January the 3rd. And I suspect that when I come back on January the 3rd, it'll be a whole lot different than it is, Christmas Eve, Christmas Day, and Boxing Day. There'll be more numbers, and I know there's a lot of talk about, Omicron is not as severe, from my perspective, and I think that for everybody's perspective, that should be, a non-discussion point and almost irrelevant. There's just going to be so many people infected. There's going to be a lot of people come into the hospital, and there's going to be a lot of people wondering how this happened again. So, all I can hope is that, people are vaccinated as much as they can be, and they take care of themselves by, being observant of their social scenarios and canceling scenarios and social interactions where maybe there's going to be too much interaction and put everybody at risk. Because the more risk that we take, the more that the healthcare profession is going to have to support them through that process.
Do you have coping mechanisms that you've either had to have throughout your career or maybe had to draw upon in the recent months in terms of how do you motivate yourself? How do you get through the day? How do you motivate the people you work with?
I think motivating myself sometimes isn't too difficult. I mean, I think that we work long hours, and certainly it's become much more complex in terms of the use of our PPE, and But I think that on one hand, for this wave, we have more medicines and more intellectual skill sets than what we've had before. We know how to manage this virus, and even though there's going to be a lot of cases, we will have probably a new tool set from a medical perspective. But as I was describing earlier, I mean, some of those connections that we were very dependent upon for support, emotional and spiritual, aren't going to be there at work. And at home, it does cause a lot of strain. You come home tired. And, in my case, I have an incredible, partner who helps me get through these moments. And in this Christmas, it'll be her and I. Our children, we've had to, we've chosen not to interact with them at this Christmas. And the same with our family in Northern Alberta. So, some of those things that we would normally fall upon, we can't necessarily. But at the end of the day, there is a light at the end of this tunnel. And I know that I do good things for people who need help at a time that they didn't choose to get sick. I think that if we get vaccinated and we sort of contract our social, interaction, we can prevent a lot of this. But each individual hasn't chosen to get sick. And I've chosen to help them get better if they do get sick. So, it continues to be my motivation.
Light at the end of the tunnel. Let's take that and run with it for now. Doctor, I want to thank you for your time. Really appreciate it. All the best for the holidays.
Thank you very much, and happy to your family as well.
Thank you. Dr. Dorscheid. He is a critical care physician, and he joined us from Vancouver.